Thank you, Mr Speaker. My question is to the Minister for Health and Wellbeing. Can the Minister please update my Peterborough community as to the progress that might have been made regarding their getting access to a GP? With your leave and that of the House, sir, I'll explain further.
Leave is sought. Is leave granted?
Thank you. As you know, the Goyder Line Medical Clinic ceased operation on the 8th of August, withdrawing their GP services to Peterborough people, but kept their clinics at Jamestown and Orroroo, where we still have a GP present there. There has been correspondence to your department and also to the Federal Minister for Health. However, the community are still not aware of any improvement for their access to a medical GP without having to travel long distances, as many of those in this community do not have the ability or able to afford to do so.
The Minister for Health.
Well, thank you very much, and I thank the member for Stewart for his question and his advocacy on behalf of his community, and in particular, in this case, in Peterborough. And as we've talked about in the House before, the GP services have been provided in the Peterborough community for many, many years by the Goyder Line Clinic. They recently made a decision that they were going to consolidate their services in both Jamestown and Orroroo, not providing those services in Peterborough. That's obviously something that is concerning to the Peterborough community, but I think, certainly Goyder's Line, I wouldn't want to critique them. They've provided services to that community for a very long period of time. Obviously, GP services, Medicare, primary health care, predominantly the area of responsibility of the federal government, but obviously it's something that everybody in the state is concerned about. I know the member himself, as well as myself, have written to the federal minister about this issue and received responses from Mark Butler about this issue, and obviously the federal government are making a number of investments in terms of primary care to try to address issues not just in Peterborough but across all of regional Australia in terms of where there are issues of shortages. However, of course, we want to see this continually try to be addressed as soon as possible in terms of Peterborough. From our perspective of the state government, our primary responsibility is providing the hospital services. Those GPs were providing the services to cover the Peterborough Hospital. We've now had to step in and engage locum services to provide coverage for the Peterborough Hospital, which is obviously something we would rather not do, but we need to keep that hospital open and providing those critical services to the Peterborough community. And I've been very regularly engaged with the York and Northern Local Health Network in terms of this issue. They've been talking, of course, to Goyder's Line to try to investigate any other ways in which we could look at how we could get these services re-established. One area that we are examining at the moment is an application that we could make to the Commonwealth Government to seek to make an exemption under the Medicare rules for what's called a COAG Section 19(2) exemption. This would enable the state government to be able to provide those Medicare billable services to the community. This is something that we use in a number of places across the state already, particularly the member for Flinders electorate, a lot on the Eyre Peninsula where we have particular shortages of GPs. And so this is something that we are actively working on, looking at making an application to the Commonwealth at the moment. So we're currently in consultation, which is necessary under the processes for 19(2). It's an application process requirement, and that will be subject to the federal government approval for that to happen. And so we've been working with the Commonwealth on this matter already and liaising with them leading up to that finalisation of that submission. We're also exploring any other opportunities that we have to support primary care in the York and Northern region, and one area that I've previously raised to the member but also to the House previously is we've got a primary care pilot program which has enabled us to invest in some nurse practitioner roles across the state, which has been successful so far. So we're seeing whether some of the funding that we've been able to achieve from the federal government for that program we might be able to use in a useful way in the mid-north to be able to support Peterborough services, but those services obviously have to be supervised by a GP as well. So whether there's a mix of services or a support that can enable that to bolster services through Peterborough, we're currently involved in exploring as well. Good news, of course, is that there are now more regional GPs being trained. All of our GP training places across the state are full, and Flinders University have now got regional doctors being trained as well. So there is a future pipeline there coming down the track as well.